I am Marcus Tai, Dean of the College of Health Professions at Pace University, and it's my great pleasure to welcome you to our first of grand rounds of the CHP College of Health Professions Grand Rounds. I would like to extend a special welcome to our panelists who are joining us from 4 different time zones to share their perspective on the future of global health governance. As we know, COVID-19 pandemic has reminded us of the importance of cooperation between countries to address health challenges and the profound difficulties of actually achieving that cooperation and the failures within many countries as well as between countries to really be able to save the most lives possible. We have also observed profound disparities in the response from different regions across the world and the access to different technologies. Today, we will hear from experts from Africa, Asia, Europe, and Latin America on what is next for global health from the perspective of their regions. We'll discuss lessons learned from COVID-19 pandemic for the governance of global health and how to address future challenges. I would like to introduce the co-chair and co-moderator, Dr. Ana Amaya, a Doctor of Public Health and Master of Public Health, who is an assistant professor in health science in the College of Health Professions at Pace, and an honorary associate research fellow at the United Nations University, UNU-CRIS. In addition, she teaches on the Global Health Policy MSc program at the London School of Hygiene and Tropical Medicine. Her research examines health policy and multi-level governance for health, with a particular focus on understanding the impact of new global health institutions and issues on the health systems of low and middle income countries. Her recent work has explored regional organizations in the Global South, the impact of COVID-19 on health inequities, and the global governance of health. She also sits on the Executive Board of Health Systems Global, a global membership organization of researchers, decision makers, and implementers dedicated to promoting health policy and systems research and knowledge generation. And Dr. Amaya will introduce our other panelists, who I would truly like to thank for their time in joining us today. Thank you.
Thank you, Dean Tai, for that introduction and also for inviting us to give this talk. We're very excited to be here today, as you said, with representatives from 4 continents, including the Americas, to have an open discussion around lessons learned from the COVID-19 pandemic and what we want from the future of public health and global health to look like. And of course, undoubtedly, COVID-19 has exposed existing inequities within and across countries that we've seen we can no longer brush under the carpet. Every country has experienced devastating losses of lives, jobs, and obviously also significant disease burdens. But what we see in reality is that the impact on countries has not been equal. And likewise, we know the recovery so far has varied considerably across the world. This is especially the case for low and middle income countries, many of which were already experiencing health or economic crises before the pandemic. We know that nearly half of the world's population has received at least 1 dose of the COVID-19 vaccine, where more than 3/4 of these doses have been administered only in high or upper middle income countries. And in reality, this is not only an issue of financing, but also an inability of the international system to ensure the equal access of vaccines and other supplies that are needed to fight the pandemic. Even before the pandemic, we were aware that negotiations and decision-making at the global level is very much dominated by the interests of high-income countries. And COVID-19 has highlighted those power differentials, not only globally, but also regionally and locally. And while the pandemic has reinforced this sense of interdependence across countries, in practice, we have also seen that many countries have decided to act in isolation. And certainly in a time of crisis, we can see this as an opportunity for change, but it will be important to see in the coming months whether new forms of work will emerge or existing ones will be reconfigured. So to talk about all of this, we're really honored to have 2 experts who will give us their views from their regions, Dr. Buenaventura and Dr. Buenaventura. We decided to have representatives from Africa and Asia because these are really 2 regions that have shown in practice how regional cooperation can be successful during a pandemic, during regular times as well. And they're also very much well-placed in indicating to us what needs to change at the global level. I'm also very pleased to have Dr. Delombard join me in moderating this discussion. Dr. Delombard is the director of the United Nations University Institute on Comparative Regional Integration Studies, and he is based in Bruges, Belgium. He is also associate professor of international economics at Neoma Business School, and previously he worked as associate director and research fellow at UNICRIS. He has published widely on international trade, comparative regional integration, Latin American and Southeast Asian regionalism, as well as globalization and regionalization indicators. He will move on to the next step of introducing our panelists and explaining a little bit about how we'll structure today's discussion. So over to you, Philippe.
Thank you very much, Anna. First of all, thanks to the hosts of today and Pace University for taking this initiative, and thanks to Anna for making all this happen. I will briefly introduce the two speakers, the two experts we have with us today, and also thanks, of course, to Agnes and Joelle for accepting our invitation. And then afterwards, I will briefly explain how the session will be organized. Dr. Agnes Binagwaho is a Rwandan pediatrician. Since 1996, she has held several posts in the Rwandan health sector, including as executive secretary of the National AIDS Control Commission. She has been permanent secretary of the Ministry of Health, and she has been for 5 years the Minister of Health of Rwanda. She is currently the Vice Chancellor of the University of Global Health Equity, also based in Rwanda, and she is also the co-founder of the university. In addition to that, she has several advisory roles, including at the WHO, and we are very happy, Anna and myself, that we have been able to co-author a policy brief recently on regional health cooperation in the context of the T20. So welcome, Agnes, to this panel. Our second expert today from another continent, from Asia, is Dr. Joelle Buenaventura. He is the division chief of the International Relations and Diplomacy Division at the Department of Health in the Philippines. Previously, he has been working as a rural health physician, has been working at the WHO and also with Médecins Sans Frontières. So also welcome, Joelle, to this panel. Thanks for accepting our invitation. So in terms of the organization of this panel, what we are going to do is the following. We will have first of all 2 rounds of interventions of our 2 experts, organized around 2 fairly general questions. After that, we will open the floor for questions from the audience, a Q&A session of about 20 minutes normally. The first question we will ask our experts to answer is let's say, rather backward-looking. It is a question about the lessons we can draw from this COVID-19 crisis for global health governance. This is a fairly general question, but it is obviously the right moment to ask this kind of question. So before the crisis, we had a global health system in place with its institutions, its actors, both the public sector, private sector at different levels, the multilateral, regional, national, local. So we had a system in place. Now we are 2 years later, we have seen this crisis developing. Question that it naturally emerges is, okay, what have we learned? What have we learned from the response or the non-response or the deficient response of the system to that crisis? So that is the first question, very general, that we will launch. Obviously, the two speakers will be able to approach that question from their experience, their angle, from their regions. So please, I will give the floor first to Agnes for a short intervention, 5 to 7 minutes,
Okay.
and then followed by Joelle. So,
thank you, Philippe, for giving me the floor, and hello, Anna, and all my co-panelists here. There are several lessons we can learn. And one important one, I will go maybe for 3 because the 5 minutes, 7 minutes, it's not so much. So the first one is the world has been reminded that health should be at the center of all development agenda. The COVID-19 pandemic has not only caused immeasurable suffering and over 5 million deaths today, but it has also disrupted the development agenda of many low and mid-income countries. As in 2020, the UN SDG goal report noted that by March 2020, we have seen so many countries rolling back in immunization program at a level of 1970s. And this is dramatic. Because that means we have the death due to COVID, but we are going to have, again, death due to infectious disease because the vaccination program were not performing. So the school also has been disrupted with so many dropped out of school, but also knowing that in many low-income countries, girls may not be back to school. And the economic situation also with more than 150 million people that will entered in poverty this year. The second lesson is COVID will be remembered as the pandemic that has highlighted inequities, not created inequities. There is nothing new. It's just that it has become more scandalous. So while past epidemic and pandemic have also disproportionately affected the most vulnerable across countries and between countries, COVID-19 impacted all countries severely, and that was discussed widely, showing and demonstrate widely. People of minorities in all countries have suffered more. And low and mid-income countries, like you have said, Anna, have been impacted so much with little capacity to respond. So what we can say that if Black and brown people have died more in high-income countries, it's not for genetic reason, because it's not the case in Africa, but it's because of the structural violence of their society, the society where they live, and the difference of care they receive during COVID, but also before. So if we see a country like the US, where it's the case, there is an acknowledgement of the care given to the Black community that it's not the same as even in the same hospital. And this is so a bias inherent of the culture that there is a lot of work to do there. It was the case also in the UK. Now for the vaccine, it's not due to the fact that people were not willing to be vaccinated, or also not always due to geographic accessibility. When the vaccine were available, there was a lack of trust due to the history of the minorities vis-à-vis the power, vis-à-vis the government, vis-à-vis the judiciary protection they can have if they were mistreated. And what we have today as another inequity that it's almost unacceptable. We have less than 6% of African population fully vaccinated today, while in the US it's 57%. But why there is no vaccine in the market for people in Africa? because at the end of the day, there is so much storage in high-income countries. They will have 1 billion doses in stock, unused, just to be stocked. And we cannot find them on the market. So there is also this, COVID has shown that law is not implemented the same way for all. We have seen the US accused of piracy by redirecting medical tools to fight COVID-19 from Germany and Barbados, and also redirecting shipment at Shanghai that were intended for the French region by buying them on the tarmac when they were no longer belonging to the factory because they have been paid and about to be shipped. And those acts of piracy were, nobody is accountable for that. So there is something that when it's against the value of morality and ethic, it has no value for, it's like water for the rich countries. And this have to change. And in the governance of the post-COVID era, we need to change that. We knew it's not new, but it was so scandalous that I remember how the world was going against piracy in the Somali, in the water around Africa. Everybody was ready to send submarine and shoot them. And then they are doing it because they need it. There is an ethics. It's there or not there. So the COVID is also the pandemic that will make us reflect how democracy has rolled back and how the principle of democracy, equity, justice, and governance have rolled back. And this is something we have to work on. It started well with COVAX, and we believe that there will be solidarity and people will work to stop the spread of the disease by vaccinating those who were the science advisors to vaccinate, meaning those who spread the disease and those who are needed to stop the spread of the disease. And it was not the case because COVAX, that country signed, were rapidly ignored. Now it come back when some country reach herd immunity, but we cannot forget that. And the example given by those who were positioned themselves as the model of the world were really dramatically bad. So those are areas where we need to reflect, to work, to change. We need new regulation globally because there will be other pandemic or other situation like that. We need to base more the interaction between countries on solidarities, on mutual respect, on the value of a life is a life. And I don't say that rich countries should not vaccinate their people first. I just say it's criminal to store a vaccine not used when other people are dying. And when also many African countries has paid in advance and not serve because the manufacturer bring their vaccine to that stock, that even if that stock has been paid after. So even so, there is nothing for me. I'm happy how my continent has reacted in solidarity based on science. I'm totally unhappy on how the rich country have reacted as nationalists, liars, pirates, and not fulfill their words. A lot to discuss, and I'm ready to. Thank you, Philip.
Thank you very much, Agnes, for your assessment of the functioning of or the non-functioning of the global health governance system in circumstances of crisis. And now I would like to ask Joelle to give his perspective on this. Joelle?
Merci, Philip. Good morning from the Philippines. It's actually 12:32 a.m., but it's okay. Um, it's a tough act to follow, Agnes, what she has said. And I actually echo a lot of the things that she has said, especially about, health being at the center of it all. And, I always believe that, health in all policy should always be a cornerstone in the discussions, especially in global health discussions. So health in all should equate to health for all. And I think that also because of we're disregarding somehow this basic tenets that what Agnes mentioned also about the high COVID-19 highlighting health inequities is of course very much I think a very important issue during this COVID-19 pandemic. I'd like to probably shift a bit on 3 points as well because I have limited time on this part. But I think the first thing of the lesson learned is for us is number one. I think we are simply not prepared for this COVID-19 pandemic. I mean, usually in pandemics, the low middle income countries would have their health systems will fail, or there will be more inequities there. But now we've seen that even in COVID-19, that even wealthy countries actually, like the deluge of the pandemic for even the UK, the Italy before, and equally important is the image of lack of oxygen in India, and so it affected all countries. So it just says that there's not enough investments in health. We have chronically underfunded health, and I think this is just manifestations of that chronic underfunding. I think that's my first point on that we are simply not prepared for this pandemic. And I think I'm also attending another meeting on at the WHO right now as representative of the Philippines, to the fourth for the working group basically on pandemic preparedness and response. And I think this one would align with the point about that we need a better global health governance. I think personally, WHO as an institution, I believe in WHO as an institution, but simply this institution is not apt to do what it's supposed to do. And I think issues of sustainable financing at the WHO with more voluntary contributions than assessed contributions are really hindering, WHO, its function. And like member states can all say, WHO do this, WHO do that. But I think there is this glaring need for a better global health governance. And I think better institution with explicit health mandates are really needed. And I think even if we have established COVAX as Agnes has mentioned, trying to promote the equity part in the conversations, I think it was not enough. And I think we need better global health governance. And I think finally, coming back from what I said initially, that health, that there should be health in all policies. I think we need to realize that it's not just about the health sector, but it's all about the other sectors as well. Health should be backed up by all stakeholders from all various sectors, because as we have seen, politics, economy, balancing health and economy has always been a very big issue during this pandemic. And I think it just speaks up in terms of the necessity for also for the health people to think beyond health. So we see, all these things about vaccine nationalism. These are not, negotiated mainly by the health people, but by diplomats. So health and diplomacy. In the US, for example, during the Trump administration, there was no funding for much of the COVAX facility, but and then politically it reversed during the Biden administration. So this was not decided by the health people, by the technical experts in health, but by people outside of health. So I think that one of the lessons learned is really how to have that multi-sectoral mechanism in place so that we can address all these issues. And I think the pandemic has greatly emphasized this this issue that as Tedros said, Dr. Tedros said, no one is safe until everyone is safe. And it's really showing you that, health security in one country does not equate health security if there were health security in another country, and until the last person is secure in terms of health, then that's the only time we'll have health insecurity. So I think lessons learned, we have to take all of these and really build back better. Like we need to build better global health governance backed by all stakeholders from all sectors. And I think towards the second part of the talk that I'll be talking about, really focusing more on institutions at the national and the regional level, because I think these are more when a pandemic such as COVID-19 hits, it's like you don't ask people, like Asian people will not ask people from across the planet, but actually they'll ask their neighbors, just like Africa did. And acting in solidarity is, I think that's really the future of really cooperation is at the national, regional level. So I think I'll end with that and maybe have some other thoughts on the second round. Thank you.
Thank you very much, Joelle. Let me perhaps first of all inform the audience that you can use the chat box to ask your questions. These questions will then be picked up by Anna and in the Q&A session that she will then moderate. But before that, we have a second round with our experts, and obviously it's very difficult to look backwards without looking forward, and you have already emphasized the need to rethink the global health governance system. You have already indicated also some of the principles that should be, let's say, basis for such a system. But we would like to ask you to develop your ideas a bit further on, okay, what is next, what is on the agenda, what should be on the agenda, not only focusing on the multilateral level and how it relates to the national level, but also, and that is also one of the things we are looking at from our perspective at UNU Chris, to look at the intermediate level, this regional level, the level where regional organizations are present, to give us your thoughts about the potential role, and the potential role that these organizations, or that put more broadly, that regional governance level should play. When we look at the crisis and how it has developed, we have seen the limitations of national health policies, especially in context of epidemics. It's very clear where the limitations are. We have also seen the potential value added of regional cooperation, starting with cross-border cooperation, but sometimes wider, at the level of wider regions. This, for example, was visible when We were looking at the restrictions to the mobility of people. At some point, restrictions were put in place, but if they were not coordinated across borders, you have a problem. So there are other aspects, for example, the potential of joint procurement or joint production of medicines and vaccines. So there are a number of, let's say, good arguments that you could use in favor of more regional cooperation. But of course, you need then the institutions capable of doing what they are supposed to do. And of course, the context of regional institutions is very different also from one region to another. In some places, there is a scarcity of such institutions that are effective. In other contexts, you have overlapping mandates, institutions with overlapping mandates, and so on. So we would also like to ask you to focus on that regional level and what your views are on how that regional governance level could play a role in between the multilateral and the national levels and the multilateral national health policies. So I will give the floor first to Agnes, please.
Thank you, Philip. This is a very important question, and it's looking forward, but taking the lessons that we have learned with a COVID-19 pandemic that has shown that health security cannot be achieved through national health governance alone. Because first of all, the virus and microbes respect no border. And with the modern world, the movement of population will increase more. But there is also something else that will increase more. And it's regionally that it has to be handled. The movement of refugees for many reasons, including climate change, because they can no longer feed their family where they are, or because of unrest. And regional organizations are the best place to help find solution locally, or to support the solution locally for health and wellness of population within a country to be protected. So regional organizations can play various roles in facilitating health service delivery and health governance. First, regional organizations can provide the guidance and technical advice on matters related to health, from protocol for treatment to other public health measures that respond to disease outbreak and that are adapted to the countries and that are adapted to the culture. Much like WHO serves as a normative institution globally, we have regionally institutions that provide guidelines, regional organizations that translate those general guidelines of WHO into more adapted advice for country. And we have seen that in Africa with CDC Africa. CDC Africa has played a fantastic role during helping countries to respond to COVID. When the first case happened on the continent, CDC Africa called all ministers of health and reviewed together the scientific advice and convinced them to go home and apply them. They were analyzed with what we have, because even if we have to do lockdown, it's not the same in a country where the majority of people have a formal work. In Africa, more than 50% have an informal work with no reserve, financial reserve, and less capacity to pass through that safely. So they discuss all this, and that has made the response of the continent what we can see. In that meeting, so ministers agreed to adopt the prevention approach to avoid overwhelming of the health system, because we knew that our safety was to avoid the spread because we don't have enough ICU. We don't have enough respirators. So not stopping the spread was surely condemn many people to death because of having many countries having weak health systems. Also, if you see a country like mine, we have 5 neighbors. If we don't align what we do, you know, you can cross Rwanda rapidly from the north to the south, east to west, and you have crossed 3 countries. So those countries, we didn't all align in the beginning. We had Tanzania, who really took the view of the US. And we had to have the support of Kenya, Uganda, etc., to come together to block it, because we were all in danger. This happened through regional organization, understanding what was the problem that can be solved regionally. We had transporters of goods that has to come through 2 other countries before reaching Rwanda and Burundi. And there were really causes of the spread of the disease. So the country came together and found a system of GPS to attach to each truck, so that when one was found positive in one of the country, the information can be sent in all places that driver had stopped and help contract tracing. This was done safely just because regional organizations were helping to do that in East Africa. Driver was safe, go to treatment, and also the population was protected. So protocol, guidelines, adapting, but also, like you said, procurement. You know that production and procurement, Africa produced little. We are going to change that. But at that time, we had to buy so many things outside, and our order were not considered. And CDC Africa again create a system of pool procurement so that many countries procure and have a power on the market to be considered. If not, they were just putting you on the queue and serve all the rest of the world. So procurement, but also manufacturing. Today, in the future, we are going to manufacture more drugs, more tools, and vaccine. And African Union and CDC Africa are helping countries to coordinate, not all countries to do the same. Country to work in synergy. How to do that for the benefit of the African countries. So another thing is that those production reinforcing and ensuring their quality, if all countries now go to do that, it will take years. But the continent come together and create an agency for, a medical agency for, like the FDA at a continental level that countries have agreed and signed to follow, so that all the resources of Africa can come together through regional entities to create a security in the production, a security for the people, to buy it, to use it, and assure that this is quality. So that's the role of African Union in that. Third, sharing data and sharing alert system, and also education. But dissemination of information, dissemination of how to do it, reassure the population all together, because if, for example, there were collapse in some countries that had all the system in place, It's because of lack of trust. And it is a lack of trust. We know that before COVID-19, that lack of trust make the families take less the vaccine. And this, we see now the consequences. So how to build together all what it needs to create a national resilient health system that is a safeguard for your country, but also your neighbor and your region. We need our regional institution to work on that, and very seriously. Thank you, Philippe.
Thank you very much. I immediately give the floor to Joelle for
All right.
second intervention, please.
Okay. Thank you very much. I think in terms of the concept of regional health cooperation for Asia, that's quite, I think, a tall order for Asia, because as you know, Asia is so diverse, and like we have Asia has the China and India with how many billion of the world's population, and on the other end of the spectrum are the small Pacific island countries with less than probably 10,000 population. And so there's like this great diversity in Asia of even with in terms of topography, like the ones in the Himalayas versus the islands of Indonesia and the Philippines. So which are basically the top two, archipelagic nations in the world. And so it's quite hard to really talk about regional health cooperation in that context. So I think in my opinion, for Asia, it has to be a sub-regional health cooperation because of this diversity and really in terms of Asia being the largest continent, it's really hard to really collaborate from one end of Asia to the other end. In that sense, I think I'd like to talk about the sub-regional cooperation in health in the ASEAN. I think it's quite difficult also for us to talk about ASEAN because also how, of course, like the 10 ASEAN member states is straddled between WHO regional office. So we have some of the ASEAN member states as member of the CRO, or the Southeast Asian region, like Indonesia and Thailand, and the other half will be are in the WIPRO, or the Western Pacific Regional Office, which is headquartered here in Manila, like Singapore, Vietnam, Cambodia. So it's actually hard for these two WHOs, based on experience, to talk to each other, and so that's why it's in the context of sub-regional health cooperation in the ASEAN, it's more important for us to really cooperate because we are straddled between the two regional offices. Of course, we have some of the strategies are quite linked, but of course, say for example, for WIPRO, for pandemics, we have the APSED, the Asia Pacific strategy for emerging diseases, and so it's a different plan with the other ASEAN member states in the CRO. But I think in terms of the sub-regional health governance in the ASEAN, it's still, I would say, compared to what Agnes was talking about, the African CDC. Of course, there are dreams for ASEAN, so we're now actually negotiating and for the establishment of ACFI, the ASEAN Center for Public Health Emergency and Emerging Diseases. So it's like the ASEAN CDC basically, and based on these regional models. And so I think the direction that is taking shape in the region is towards really strengthening this health cooperation. And I think we see in the pandemics all of these issues about inequities in access. So there has been really a lot of talk, especially during this pandemic, about regional health security, regional vaccine sufficiency, regional drug sufficiency, which I think is in the broader context of the ASEAN region is very important. Especially, I think we have India as the pharmacy of the world, and China, especially in terms of the the mask supply of the masks and PPEs before. It's I think something that has to be really well coordinated, both at the sub-regional and the regional level. And I think in the discussions about the benefits of regional health cooperation, I go back to my previous statements that it should go really beyond thinking about the national level, but involving stakeholders beyond your borders as well. And so I think it's a very important concept. I think multilateralism and regionalism in this case would be a direction that we have to go, whether we like it or not. And I think cooperation at the regional level is something that, if strengthened, will really be a powerful tool against the fighting the next pandemic. Thank you.
Thank you very much, Joelle. I think we have about 15 minutes left for Q&A, so I will hand over to Anna.
Thank you so much, Joel and Agnes, for your interventions. These have been really important food for thought in terms of not only the COVID-19 impact on health, but also impact on development. Agnes also brought up important issues around ethics and the issue of justice, and justice not being applied equally across the world, which I think is an important consideration. We also need to keep in mind for future discussions and negotiations, perhaps at the multilateral level. Joel also brought up important points around the prioritization of health, not only financing, but also collaboration and the work that perhaps as practitioners and researchers we need to do to increase the attention that is placed on health. Now is really the opportunity to highlight why all sectors should be thinking about health issues. And then also related to the value of regional organizations to coordinate as well as mediate differences between countries. And I really liked what Joel said also about regional cooperation maybe being inevitable. I hope it's not as dire as it having to be inevitable, but obviously the value of the sub-regional level and the value of working intergovernmentally when perhaps WHO structures aren't sufficient. And then also my own thoughts, perhaps seeing African Union and its successes as a good model for other South types of cooperation. So thank you very much. And now I have some few questions already in the line. The first of these is from Dean Tai. He says, in terms of building regional sufficiency, do you think it is more important to focus on building domestic production capacity or to relax intellectual property protections, particularly favor corporations of the global north? Really, really important question, and actually things that are being discussed as we speak. So who would like to take that one first? Maybe I'll hand over to Joel. Great.
Yeah, I could try to stab on that. I think the concept of domestic production for me is something, seeing how the global supply chain has really been a big problem during this pandemic. I think we have to think about more on the context of not domestic, but actually more of a regional. So I think the discussions nowadays is really more on regional vaccine self-sufficiency, regional drug self-sufficiency, and I think we know that there are countries which have already the technologies that are capable to do that, and I think it's it's gonna be hard, especially for those countries without those technologies to actually I mean, it takes really a lot of investments in terms of like producing your first dose of vaccine per country, and I think this is something that I've also realized, like the amount of investments that has to be given in for a country to develop, you know, the technology to have, especially like I think, you know, we see that in COVID-19 new vaccine platforms has been developed, like the mRNAs, and this, I mean, even if I think in the case of Philippines, even if you have the money, you know, to put up the plant or the lab to do this, but it takes people as well, training people, and this takes time. It's not, I think, so in terms of you know, putting this up, I think sometimes it's better to think of it as a region, especially for countries which will definitely lack the capacity and the investments to do that. So for example, in the ASEAN, we're looking at, because I think for us, we see Thailand and Singapore. Thailand is actually the one which is producing the vaccines, has the capacity to produce vaccines, but we're going to support Thailand to produce more for the region. And I think that's the context, rather than really, I think, putting up domestic investments. Of course, there are, for COVID-19 vaccines and the other, you know, important vaccines, that's at least in the pipeline for ASEAN. Over.
Thank you, Joel. Agnes, I'm going to give you an opportunity to also respond to this, since I know there have been some...
Totally agree. I totally agree. Can you imagine that we have to, because there is not only COVID vaccine, COVID is the drama of today, and tomorrow it will be the drama of yesterday. So there is all other vaccine. What we have seen is that Africa need the capacity in, let's say we are 54 countries, in 10 countries to do vaccine. Not all countries, it's a nonsense, but sharing the capacity for different disease. Remember that 94% of Africans are dying with malaria, 94%. So those are things we need to think. When factories are developing the knowledge and patent with public money, or with money of people like Zuckerberg or Gates, they should put a notice that it belongs to the world, not for Pfizer to be more rich and let people die for not sharing. But there is something else we need to think about. Is not only to have the patent is a paper, you know? It's to have the know-how to use. It's like doing a cake. You have a nice recipe in a book. It's not for that you are going to successfully do the cake. You need the know-how to put the ingredient together, when, how. So these are things that should be shared. And because those big pharma have done that with public money and with money coming from your pocket, Anna, coming from the pocket of the work done by people working with Bill Gates, it should belong to the world. But as I say, they should not lose money because they share. They should use the patent system of Coca-Cola. There are factories all over the world. And when somebody drinks a Coca-Cola in a corner of the world, Coca-Cola in US make business.
Exactly, really great points. And not only Coca-Cola's recipe, but also their distribution mechanisms, where, you know, even in rural areas, you can find a Coca-Cola in El Salvador, where, you know.
And also the know-how to make it.
Yes.
That's
so
very important, because they can send me by post office all the recipe. I'm not sure my country will be better.
Yeah. Great. So we have a question from Erica. Do you want to unmute yourself? And
yes, thanks. First, I wanted to thank the amazing speaker panel and the moderator panel for some really exciting and elucidating presentations this afternoon. It's really sort of brought up so many issues, and I don't really know where to start. I have several questions. So thank you. I think I'll start really with Dr. Buenaventura's example of CDC Africa, because, and especially in respect to the students, of several students that are listening in, and perhaps you could speak a little bit more about the foundation of that regional organization, the governance, since it is a good model, and just elaborate a bit more on sort of what are the possibilities and limitations of that structure to address the, the terrible, the devastating need now going forward, and all the ways that COVID has impacted our progress towards these health indicators. I was just speaking with my students earlier this week about the impact on tuberculosis and malaria, and and the major killers in the on the continent. So that would be my first question. Thanks.
Agnes, would you like to take that one? I think you're muted.
Oh yeah, I was talking to myself, sorry. And my flowers. So I want to say that CDC Africa report to African Union. African Union report to head of states. African Union as a governance body where all ministers of health are meeting annually or something like that. And to do a plan for Africa. It has been starting to be strong in 2018 with the Ebola big outbreak. 4 countries in Africa, 5 in fact, 2, they stop it very quickly, but Africa solved it because of African Union. The first to say enough is enough guy, we need to. And now, for example, CDC Africa made the secretariat of all the committees the African Union has put in place for vaccine manufacturing, for drug certification, for et cetera, for protocols. So we have many committees like that are scientific, made by academicians and researchers and manufacturers. And the secretariat is done by CDC Africa. So it works well. It has supported science because, something we don't say, COVID is the prototype of virus that has become more politician than any minister. I never believe an epidemic, a pandemic, an outbreak of virus can be so political. CDC Africa has protected Africa because it's not that it didn't happen in Africa. I know 2 countries, by the way, the head of states died with COVID, but they deny COVID up to their last breath. Now it has changed. So that's how it works. They make the Ministry of Health accountable to African Union, what is easy because it's not to their president. It's to the Assembly of Presidents. So when there are some who are too dangerous, they come together and say enough is enough. And it's so important in a period where the example given by those who are supposed to give example to the world, the rich world, have made politics the first answer to a disease.
Thank you, Agnes. Really, really important reflection about how it has worked and perhaps a few of the steps it still needs to take. I'm aware that we have run out of time, but I don't know if you can stay a bit longer. I know there's a lot to discuss, a lot of questions, and I hope this is only the first step towards a wider discussion and perhaps more consideration of the needs of the Global South in the COVID-19 pandemic, but also future discussions around health, and not just COVID-19, which, as you say, is a concern of today, but there are many other concerns right now related to climate change, related to dengue fever, malaria, tuberculosis, all of these other diseases. So with this, I will leave the floor to Philippe for some final thoughts. But on my side, I want to thank everyone, especially our panel, for making the time to join us. And again, the College of Health Professions, Dean Tai, for inviting us, and Sophie for her wonderful coordination and help as well. So I'll leave it to you, Philippe.
And I'd just like to thank, before you do, recognize Assistant Dean Sophie Kaufman for her efforts in organizing, to thank those of you who've attended, and our panelists, Dr. Binawaho, Dr. Maya, Dr. Dilambadi, and Dr. Buenaventura, for this very important and informative discussion. And to also encourage you to go to the website to look for our future CHP Grand Rounds, which are still being scheduled, some of which are practice-based and some of which, like this, about extremely high level and important issues. And then to turn it over to Philippe. Thank you.
Thank you very much. Well, given the fact that we have run out of time, I will also limit myself basically to thank the audience for being here with us today. Thank our host, Pace University, but especially to thank our two experts, Agnes and Joelle, for their generosity in sharing their knowledge and ideas with us, with all of us. So thank you very much. And we'll be in touch. So thank you very much.
Bye-bye, and thank you.